Predict a heart attack with a blood test. Millions of people die from a heart attack each year. But what if there was a way to predict if you were going to have a heart attack? Hi! Welcome back to Health Shadow. And in this video, we are going to talk about whether or not blood tests can help predict a heart attack. Up until now, doctors haven't been able to accurately tell who's at risk for a heart attack. But recent studies show that there may be a way to do just that. The human heart is an organ that circulates blood throughout the body via the circulatory system's veins, giving oxygen and nutrients to tissues while eliminating carbon dioxide and other pollutants. Before all of that, welcome back to Health Shadow, your health-related YouTube channel, ready to guide you and join you in your healthy lifestyle journey. Don't forget to subscribe and hit the tiny bell for updates. Give us a thumbs up before you jump onto the next one. The tissues of the body require a steady flow of nutrients to be active, said Dr. Lawrence Phillips, a cardiologist at New York's NYU Langone Medical Center. They will perish if unable to give blood to the organs and tissues. The human heart is situated in the middle of the chest, just to the left of the sternum. According to the Texas Heart Institute, it is located between your lungs and is contained in a double-walled sac called the pericardium. The pericardium protects and anchors the heart inside the chest. The outer layer, the parietal pericardium, and the inner layer, the serous pericardium, are lubricated by pericardial fluid. During contractions and movements of the lungs and diaphragm, the fluid lubricates the heart. There are 5 steps to a healthy cardiac contraction. The heart is calm in the first stage, early diastole. The atrium then constricts, atrial systole, to force blood into the ventricle. The ventricles then begin to contract without altering volume. The ventricles then continue to contract when empty. Finally, the ventricles relax and stop contracting. The cycle then begins again. Valves keep blood flowing in one direction via the heart by preventing backflow. Your heart will have beaten around 100,000 times by the end of the day, around 60 to 80 beats per minute. According to the Cleveland Clinic, this will pump around 1.5 gallons, approximately 6.8 liters of blood each minute across the human's body, 60,000 miles, approximately 97,000 kilometers of blood arteries. But what if it went otherwise? That you didn't actually have a healthy heart? Listen here very well. When the flow of blood to the heart is obstructed, a heart attack ensues. The most common cause of a blockage is an accumulation of fat, cholesterol, and other chemicals that create a plaque in the arteries that supplies the heart. A plaque can break and generate a clot, obstructing blood flow. Interrupted blood flow has the potential to harm or kill a portion of the heart muscle. Not everyone who has a heart attack experiences the same symptoms or the same level of symptoms. Some people have modest discomfort, while others experience severe agony. Some people show no signs of illness. For others, the initial symptom might be a cardiac arrest. The more indications and symptoms you have, however, the more likely you are suffering a heart attack. Although some heart attacks occur unexpectedly, many patients have warning signs and symptoms hours, days, or weeks in advance. The first sign might be recurring chest discomfort or pressure, which is caused by exercise and eased by rest. Angina is produced by a brief reduction in blood flow to the heart. Higher estrogen levels may lower the risk of a heart attack. As a result, women are more likely to suffer a heart attack after menopause than before. Women who suffer a heart attack, on the other hand, are more likely to be misdiagnosed and undertreated. A 2018 Swiss research, for example, discovered that women tend to wait longer to notify emergency services after suffering common heart attack symptoms. Researchers also discovered that women are more likely than males to be delayed in obtaining care in emergency rooms. Diabetes patients are more prone than non-diabetics to experience silent heart attacks, according to research. In other words, if you have diabetes, you may not have the classic signs of a heart attack, such as chest discomfort. Many research has been conducted to better understand why persons with diabetes are less likely to have chest discomfort and other signs of a heart attack. One hypothesis is that the onset of neuropathy, a form of nerve damage that is a typical symptom of diabetes, may impair the capacity to detect chest discomfort produced by a heart attack. A heart attack, also known as a myocardial infarction, can be deadly, although therapy has greatly improved over the years. If you believe you are experiencing a heart attack, call 911 or an emergency medical service immediately. But wait, what if we can see a heart attack through a blood test? Scientists are now developing a blood test method to better identify who is at danger of having a heart attack, which will eventually lead to greater prevention of heart attacks entirely. The blood test, created by SomaLogic researchers in Boulder, Colorado, examines proteins in the blood to determine if a person is at high risk of having a heart attack, as well as stroke or heart failure within the next 4 years. Discussing family history as well as procedures such as electrocardiograms, stress tests, CT scans, and MRIs are being used to diagnose cardiac disease. The problem with genetic testing is that they only provide a hazy image, whereas protein analysis can provide a more precise picture of an individual's current cellular makeup. At the moment, most clinicians depend on conventional risk factors for heart disease, such as blood pressure, high cholesterol, and diabetes, to assess an individual's risk for heart disease, said Dr. Aishita Dwivedi, a cardiologist at Lenox Hill Hospital in New York, NY. In the suitable individuals, further tests may also be done to detect cardiac disease. However, much is still unclear about who will or will not develop cardiovascular disease. The study looked at 5,000 proteins in blood plasma samples from 22,849 people. It discovered 27 proteins that may be utilized to forecast the likelihood of a heart disease-related event up to 4 years in advance. The test also assessed the risk of a cardiac event in persons who had previously experienced a heart attack or stroke and are presently taking medication to lower the risk. This study attempts to find surrogate proteins in our bodies which may aid in identification of pathways for heart disease and the creation of therapeutic alternatives, Dwivedi explained. According to preliminary study, this blood test might be twice as accurate as current techniques of determining if a person is at risk for a cardiac attack. If the blood test findings are proved to be reliable in larger trials, this information might be utilized to anticipate and treat heart attacks much more quickly. Furthermore, it has the potential to accelerate the development of novel cardiovascular medications. The test is now utilized in 4 hospital systems in the United States. Heart attacks are in a new arena because of this. What else should be done? Well, subscribe and hit the tiny bell to be updated on your favorite health and fitness channel, Health Shadow. Going back, the results are encouraging, and while the blood test is currently being used in the United States, further research may be required before it is widely recognized. More research in large-sized populations are needed to corroborate these findings, Dwivedi added. The authors analyzed a high-risk cohort, but for this data to be relevant in the future, it must be confirmed in low to intermediate risk people. Overall, she said, it's a promising research that employs technology to enhance medical knowledge. Aren't we all excited for this? If such data play out over time, it may assist in our knowledge of cardiovascular disease as well as the development of therapy possibilities, Dwivedi added. Technology and science and health development will really write down the future of all people as we're always next to various conditions and illnesses. But as we move forward with treatment and prediction, let's not forget the basics on how to stay healthy, whether we are working at home. Check out our linked video for this one. Remember the basics. Consume more fresh fruits and vegetables and fewer processed stuff. Eating a lot of meals high in saturated fat and trans fat may increase your risk of heart disease. Eating fiber-rich meals that are low in saturated fats, trans fats, and cholesterol can help avoid high cholesterol. These tricks will never get old. That sums up our video for today. You are watching Health Shadow, your health-related YouTube channel, ready to guide and join you in your healthy lifestyle journey. Don't forget to subscribe and hit the tiny bell for updates. Give us a thumbs up before you jump onto the next one. See you next time. Stay healthy.